We're so happy to have you. Um, Due to the high volume of RSVPs, this is webinar style, but we encourage people to use the chat function and reactions. So just drop your first name and your city in the chat. And we're so excited to have hundreds of people already logged on. Now, I'm delighted to introduce our interpreter, Flora, who will share interpretation instructions.
Thank you so much. It's a pleasure to be here with my colleague Murtado. I will briefly give the instructions in English and in Spanish. Hola, muy buenas noches, buenas tardes, dependiendo de dónde se nos estén uniendo. Bienvenidos a Mamás con Poder o Moms Rising. Este es un espacio completamente bilingüe, lo que quiere decir que todo el webinar que se va a hablar en inglés lo puedan escuchar en español. Solamente tienen que ir al mundito en la parte del menú de Zoom o a los 3 puntitos. Ahí seleccionen su idioma de preferencia, español, terminado, don. Por favor, si tienen cualquier dificultad con el servicio, mi colega Murtado y yo con gusto los asistiremos. Just a friendly reminder, if this is a webinar, but if there's any moment where Spanish participants are allowed to speak, just also access interpretation so you can hear everything in Spanish translated into English. Globe icon at the bottom of your screen or 3 dots. Thank you so much, and I hope you have a great webinar.
Thank you so much, Flora. Again, if anyone has any questions about that, also feel free to drop them in the chat. And we have 2 folks helping us with interpretation. Due to the high volume of RSVPs, this is webinar style, but we encourage people to use the chat function and reactions. That option is at the bottom of your screen. Once you open the chat, click on the blue box at the bottom of the chat window and select everyone so that all of us can see your comments. If you have questions, feel free to type into the question function and we will have Q&A at the end. We have 4 guest speakers today, but before we get into that, we're going to hear from Kristen as she introduces U.S. Senator Maria Cantwell.
Thank you so much, Monifa. Thank you to everyone for being on. We also encourage everyone to use the react button. So let's give some giant hearts, some giant hugs, some giant applause in the form of hearts to Monifa for starting us off and to all of you for being here today and to our speakers. Speaking of our speakers, it is my great honor to introduce a powerful U.S. Senator who is working for us every single day. She is a champion for women, for families, for our economy, for businesses, for people, for sanity. We have U.S. Senator Maria Cantwell of Washington State. She's a senior member of the Senate Finance Committee, and she serves as ranking member of the Senate Commerce Committee. She's been a champion for lowering healthcare costs and has worked across the aisle effectively to lower prescription drug costs by cracking down on pharmacy benefit managers. Earlier today, today, we have breaking news on this Zoom. She released an alarming report detailing drastic cost increases, spikes in costs of 20% to 50% for many Americans who buy their own health insurance. It is not okay. She's hoping this report, which she'll also be talking about, will be a wake-up call and highlight that the president and Republican leadership in Congress must act now to extend crucial healthcare premium tax credits. Senator Cantwell also authored the Bipartisan Trade Review Act to reestablish limits on the president's ability to impose arbitrary and harmful tariffs that are starting to inflate the cost of our food, our products, and our health care. Can we say superhero champion? Let's give her some hearts. Use those emoji buttons right now because without further delay, we welcome U.S. Senator Maria Cantwell. Welcome, Senator.
Thank you. Thank you, Kristen, and thank you to Moms Rising for their great advocacy on behalf of families all across the United States. And what a great honor to be on a call with so many people, this particular Zoom, to try to focus on how we get the message out to Americans that we can't tolerate any more Trumpflation or high costs. So again, Moms Rising and Kristen Rowe Finkbinder's leadership on so many of these issues has created that voice that is now being heard across the nation. So thank you for that. And thank you for the partnership on Trumpflation, the cost of living that is affecting so many Americans when the cost of everyday products, it could be household items, it could be food, it could be as important as health insurance, are all rising under this administration. So today we released a report that is asking the president and our colleagues in the House of Representatives and the Senate to deal with the fact that insurance rates are already being projected now in 29 states to go up over more than 20%. You're asking enrollees to enroll in these plans in the next 30 days. So that means that many Americans, while Congress doesn't want to debate the issue, many Americans have to make the awful choice. A family of four at just a small income is facing likely a $3,000 annual increase in their health insurance. They simply can't afford it. In our state, Washington, over 80,000 people got coverage under the Affordable Care Act tax credits that now are expiring. And the effect of that is a lot of those people, the 80,000, will probably, actually 300,000 got credits, 80,000 of them probably will now not be able to afford without the credits and lose their insurance. That means that people who don't have insurance are going to go into the uninsured market and drive up the cost of everybody in America. So nationally, we think 5 million Americans are going to be affected by this. And all we're asking is that Congress make this the #1 priority. If these rates are now being put out by insurance commissioners across the United States, if the open enrollment period starts as early as October 15th in Idaho and November for the rest of the nation, and you have to make a commitment to these high rates, how is it not a priority for Congress to deal with this immediately? If my Republican colleagues are serious about driving down the cost of healthcare, then figure out how you are going to keep the Affordable Care Act tax extenders that are expiring. So let's make healthcare more affordable for Americans. Let's not make it more expensive. We're already, as we said, facing the cost of Trump inflation and the cost of everyday goods that are going up. No one has spare change to now make healthcare payments that are more expensive. So please get the word out. We have in our report the list of the states that have the highest increases. And so you can see state by state. What we listed are the major insurers in that state and what their projected coverage is likely to increase. And as I said, these enrollment periods end at the very, very beginning of January. So the consequence is you're literally without congressional action asking people to just accept these higher rates. I think we should say no. We're not accepting these higher insurance rates. We want Congress to deal with it, and we want Congress to deal with it now. So thank you all very much for inviting me. I so appreciate everybody and all you're doing. Let's go out and fight for an affordable quality of life in the United States of America.
Thank you so much, Senator. Thank you, thank you. Let's give her a lot of rounds of applause, a lot of hearts, a lot of emojis. We are putting in the chat ways to share your healthcare story. Have you experienced the rising costs of healthcare? Then let's share about it. That helps change what's happening. So you can go to that link and you can share your healthcare story. We have other action links that we're putting in the chat for you to tell your members of Congress how you feel about this moment. And thank you so much for joining us. Thank you again to the Senator Cantwell. But thank you all for joining us. Thank you to Monifa. Thank you to Jada. Thank you to everybody who's here. I want to talk a little bit about what's happening. This was the opening. It's very short, but right now we know a simple grocery store run should not feel as burdensome as it does now. We know that filling up our gas tank should not feel like a major sacrifice, that healthcare, childcare, elder care should not be out of reach, that having to choose between spending on rent, childcare, healthcare, medication, or emergency funds is too often a constant suffocating stress that's wearing down parents and families across the nation. The situation is indeed urgent. As you just heard, healthcare prices are expected to go up 20 to 50% if Congress doesn't take action. Vegetable prices are already up 40%, coffee is up 33%, washing machines even are up 12%, and these healthcare costs that are expected to rocket even higher is happening not only because Republicans in Congress just made massive cuts, but because they're poised to do even more cuts. So they've broken their promise to lower costs, and instead they've put politics and profits over families, slashed our health care, and tanked our job market. And we are paying the price. That's the depressing news. The good news is that together we're powerful. The good news is that together we can make the changes that we seek. The good news is that these cuts are reversible. And if we do lots of public pressure and lots of conversation about this and share lots of stories about what's happening, then we can actually have a faster reversal. So it is time to take action. So together we're coming together with you, with national leaders, with experts, and in community to learn more about what's happening and, importantly, how we can all help save our democracy, save our healthcare, lift our families and our economy up and out of this crisis. So throughout the community Zoom, we'll be putting some actions into the chat box, and we'll also talk about them at the end. So stay tuned. And now, without further ado, I'm going to turn it back over to our spectacular, amazing, wonderful, powerful leader, Monifa Bandele. She's the Chief Operating Officer at Moms Rising. She's the Senior Vice President of Maternal Justice and Strategic Initiatives. And she is on the East Coast where the sun is not going down, covering half her face as she's talking. So I'm going to find a different location where I don't have all the sun half in my face. And I'm passing the mic to Monifa. Welcome, Monifa. Thank you.
Yes, the sun is already down here. Thank you so much, Kristen. Thank you for all that you do every day. Now I'd like to introduce our Protect Our Care champions. We have amazing speakers and partners at Protect Our Care that's going to help us figure out all the who, what, where, whens, and how that we can protect our care. So we have two speakers. First, we have Adam Hoyer. He serves as the National Organizing Director at Protect Our Care since 2017. In his role, Hoyer manages Protect Our Care's key partnerships with allied groups at the state and national levels, organizing a coalition of dozens of healthcare and progressive organizations, oversees Protects Our Care state team operations, which have executed grass-top organizing and earned media strategies in 23 states. Prior to joining Protect Our Care, someone is scrolling down or typing, so now I've lost the spot. Hoyer was a campaign and field organizing specialist, having worked on several state and national races, including both of President Obama's successful presidential election in 2008 and 2012. Hoyer holds a bachelor's degree from the University of Notre Dame, where he was a member of the men's golf team, and a master's in public policy from Georgetown University. He's originally from Tampa, Florida, and remains a proud Florida man. Then we also have his colleague, Rebecca Parks. Rebecca Parks has served as the research director at Protect Our Care since 2018, where she leads a team of researchers in support of Protect Our Care's communications and accountability work. She has over 15 years experience in opposition and policy research, including work on both Obama campaigns and at the U.S. Department of Housing and Urban Development, as well as at a variety of progressive organizations, including the Human Rights Campaign and American Bridge. Becky is a proud native of Detroit and holds a bachelor's degree from the University of Michigan. And so now I'll hand it over to our Protect Our Care team.
Thanks, Monifa. And a helpful reminder that I need to tighten up my bio. Really thrilled to be here. Huge fan of Senator Cantwell, and maybe an even bigger fan of Moms Rising. You know, we work with a lot of organizations, as you mentioned. I work with a lot of allied groups. A lot of them walk the walk, and a lot of them talk the talk, and they do not walk the walk the way that Moms Rising does. So I know everyone here knows this already, but I want everyone here to know that it is not lost on the rest of us, just how valuable Moms Rising is, just because, we are short on doers in this space and we need more of you. So thrilled to be here today. I have some slides I'm going to go over, and I'm going to hand it over to Becky. A few caveats that I want to address at the top. First of all, one, as you heard from my bio, I'm an organizer. I'm not a policy guy. I'm not a comms guy. I'm good at doing stuff. I'm less good at knowing stuff. Becky's the smart one. She was on Jeopardy once, so hang in there for the smart stuff. It'll come in just a little bit. Two, there is a lot going on in healthcare right now, a truly scary amount of threats to it. We're going to talk to you for a while tonight about a few of them, and we're not even going to touch on some of the other aspects of healthcare that are under threat. And I apologize for that. Join us for our coalition calls twice a week if you're so inclined to hear about all the horrible things that are happening in healthcare right now. Three, it has been one hell of a week in healthcare. Becky and I are overworked, we're underslept, we're all kinds of stressed and loopy, so please bear with us. And finally, apologies in advance. I am bad at PowerPoint slides. I'm sorry. I tried my best. But my goal, my hope for this, by the end of this, you will conclude, as we believe, that healthcare is super important to talk about right now, more than ever, maybe. It is important to get active around it. And I hope that by the end of the night, you are inspired to take some steps to be more involved in the healthcare fight moving forward. But that's enough with the caveats. Next slide, if you wouldn't mind, since there's been so much hype around these slides. So we are.
Have we lost Adam? Can other people hear him and I can't?
Sorry, say again?
Oh, you were paused for me for a moment, but maybe everybody else could hear you.
Okay. Hopefully we hang in there. I was paused. Okay, sorry. It looks like my internet's working well. I'm gonna keep going then. I'm assume.
Go ahead.
All right, here we go.
I was like, is it just me or is it us? I
No,
can't hear Adam
no, sorry
anymore.
about that. Sorry
Back
about
to you,
that.
Adam.
That's part of the all-out assault on our healthcare system. They've gotten to my Zoom, to my internet. So I'm going to talk a lot today about the premium tax credits that Senator Cantwell mentioned at the top, but there's more that goes into that whole context. And if Republicans continue to insist on taking away these ACA premium tax credits, 4 million Americans are going to lose their health care. Over 20 million Americans are going to see their premiums skyrocket by 75% or more. This, as working Americans are already feeling the squeeze from this administration, this Republican Congress, senseless tariffs driving up the cost of everything, Trump inflation making groceries and day-to-day costs virtually unaffordable. And now they've decided, Republicans in Congress have decided that this is a good time to force working folks to pay even more for the health insurance than they already are. We're going to talk about why we're here, how we got here, what steps we're taking to do something about it. But the bottom line is, we've seen Republicans having no problem giving billionaires and corporations a permanent break on their taxes. They'll move heaven and earth. They'll add trillions to the deficit. They'll cut Medicaid for millions of people in order to do it. But when it comes to giving working families a permanent break on their healthcare costs, that apparently is a different story. They'd rather side with insurance companies. They'd rather shut down the entire government instead. And it's madness. And it's hard to overstate the fear that families are facing around this right now. And thanks, Kristen and others from Moms Rising who put in the link to share your story. We've seen it too in states across the country where our teams are holding events. We hear from people all the time, hardworking people, small business owners, families struggling to make ends meet, and folks with really challenging health problems and medical costs. This is the last thing they need right now. So let's get a little bit into how we got into this disaster. If we could go to the next slide. It all, of course, starts with the one big beautiful bill act. It's the Trump Republican budget bill. And I think it's important to realize why they passed this, because this answers a lot of questions that come up day to day. The reason they passed this monstrosity of a bill was to give tax breaks to billionaires and corporations. And that's a really expensive thing to do. As you can see from this chart, that bar chart at the very top, that's how much that's costing us as taxpayers to give tax cuts to billionaires and corporations. They had to offset some of those costs to appease their base. And the biggest way they could get some of those costs is through healthcare, especially through Medicaid. They cut $1 trillion from Medicaid. And you can see, That's barely even a drop in the bucket when it comes to what they needed to do to offset these cuts. So when you hear like, well, why not put a Band-Aid over these rural hospitals? Why not reverse some of these cuts? Well, the reason is if they did that, they can't pay for the tax cuts that they've already greenlit for billionaires and corporations. So let's go to the next slide. We can see already that this bill is super unpopular. We know that intuitively, but when we survey and when others survey, when we get this navigator survey, we know the one big beautiful bill, the Republican tax bill, it's super unpopular. And there's a lot of reasons for it. Let's go to the next slide. The thing driving that unpopularity is exactly what I mentioned at the top. It's the loss of coverage and the higher costs. That's not surprising given how expensive everything already is. But when you're going to add costs to healthcare, which is already way too expensive in this country for way too many people, given how much we already pay into it, it's super unpopular. The more people learn about the healthcare provisions in the One Big Beautiful Bill Act, the less they like it, especially when you talk loss of coverage. And the CBO talks about the millions that are going to have to go uncovered because we're talking about people making tough choices, right? Like, okay, my insurance is going up. I'm barely making ends meet. You know, given all else, what am I going to do? Going to take groceries out of the shopping cart? Am I going to take food off the table? No, I'm going to choose to go without health insurance, and that has devastating effects. And when you talk to people about it, obviously it gets even less popular. So if we go to the next slide. Here's the point I really want to drive home. I think everyone here, if you're here, you're engaged, you're paying attention, right? You know how terrible this bill was. You know how unpopular it is when people learn about it. Here's the thing. Most people have not heard much about it. And that's because Republicans aren't going out there and telling their constituents about it. You've seen they're not holding town halls to tell people what's in this bill. So as a result, a lot of people are not aware of all the terrible things that are in it. All the more reason that we need to get active. And again, this is why I'm going to say, like, if you take nothing else from this, I hope you get energized to say, like, all right, I need to start talking to my friends. I need to talk to my neighbors. I need to yell at my member of Congress. I need to call my local reporters. I need to write an op-ed, pen in a letter to the editor, get involved in a local event. We cannot talk about this enough, not just now, but for the next year and a half, for the next 3.5 years. We go to the next slide. So by the way, like I said, there's a ton of healthcare in this bill. And to even call these the biggies is kind of shortchanging the biggies because there's a lot of other biggies. But the ones you probably heard about, first and foremost, Medicaid. This is a huge one, right? Work requirements. Kind of improperly named, these are paperwork requirements. Most people on Medicaid, especially in the bracket that we're talking about, Medicaid expansion, they're already working. But now we're forcing them to do cumbersome paperwork, right? More bureaucracy, the last thing that people want. That's how they're going to kick people off of Medicaid. It's not because people are unwilling to work or aren't working. It's because you're putting another step in between them and their health insurance. And that's not only wrong, it's against the letter of what they're trying to do, and it's against what this program was designed to do. Here's the thing, that doesn't take effect until after the midterm elections. That's by design. They know that once people get kicked off of Medicaid, not because they're not working, not because they're lazy, not because of this fictional person who's in their mom's basement playing video games all day. It's because they have to do more paperwork, more cumbersome. They have to keep being, redetermined whether or not they're eligible. That's not fair, but it's by design. We've seen this in Arkansas and Georgia. This is the point. It doesn't increase employment. It doesn't do what they say it's going to do. All it does is kick people off the rolls and save them money, which they can give to billionaires and corporations. But as I said, those things don't take effect until after the midterm elections. How convenient. Provider taxes also don't take effect for the most part. That's going to be a big burdensome on hospitals and on state budgets. And already we've seen, rural hospitals in particular, which are working on super thin margins. They're signaling already that they're going to have to close or they're going to have to make really tough decisions already. I mean, think about that. We're 2 years out from them having to see a lot of the effects of these cuts. And they're already signaling that they're going to have to close down in some of the most underserved areas we have in this country. But the last one, as I've, spoiler alert, as I've said, I'm going to focus on a lot, are the premium tax credits because those are taking effect next year. And already we've seen signals from insurers that rates are going to go up. And open enrollment begins when? November 1st. That's in just a little over a month. So people are going to start to see some sticker shock really soon. And those rates are going to start taking effect as early as January. People are going to feel that hurt really soon. Everyone in Congress knows about it. Democrats are trying to do something about it. Republicans are hoping people won't notice. So let's go to the next slide. So here's an overview of how we at Protect Our Care are viewing this. One, we see a need to pick our battles. Yes, those Medicaid cuts are going to be devastating, but they're also a thing that people aren't seeing in their immediate future. And people have lives, right? There's a lot going on for all of us. So we need to kind of latch on to the thing that people are noticing right now. And that's first and foremost the premium tax credits. That's also the rural hospitals that we see are closing and having and trying to signal to people. And that's also public health and our Secretary Kennedy, which Becky is going to speak on more in a bit. So we've got a lot of resources at Protect Our Care. All right, and at Protect Our Care, I know others do as well. The one thing I want to impart on this group is that personal stories are the thing that make the most impact. If you remember, those of you who are involved in the healthcare fight during ACA repeal in 2017 and 2018, that's what got us over the finish line. That's what defeated repeal from the Affordable Care Act, was people sharing their stories and what this bill would mean for them. We need to do that again because this affects so many people. A lot of folks on this call probably are benefiting from these premium tax credits or know someone who does. Share that story. Think globally, act locally. You know, there's press conferences going on from us, from others. But even aside from that, share your story on social media. Talk to your neighbors about this. Call your member of Congress. Write an op-ed to your local newspaper. All these things make a difference. I promise you, more is more. Let's go to the next slide, please. So the broader story, and I want to be quick about this. However, 2010, what happened in 2010? That's when the Affordable Care Act passed and it took a few years to take effect. It's hard to overstate just what an impact that had on our healthcare. I know it was kind of like a slow burn, partially because there's kind of a backlash to it initially, and partially because there's been a lot of information since then, and also because like the idea of the ACA was it was supposed to be what President Obama called a starter house, right? You're supposed to build on it over time, and that's exactly what's happened both under Obama's administration and the Biden administration. The enhanced premium tax credits, they really built on what the ACA started in terms of making insurance even more affordable, not just for the folks who are in that 125% of poverty level and those who benefited from Medicaid expansion, but now we're going up to 400% of poverty level and beyond, people who are eligible for those. And the result has been, I think 2024 was cut off when we saw an even bigger dip in unemployed rate and uninsured rate. It's been more than cut in half from where we were when the ACA was enacted. Next slide, please. And the biggest driver of these, the people who are benefiting the most are people, as I mentioned, they're working class people, right? Like that's who gets the most benefit from these enhanced premium tax credits. And now we see, not just the people that you might think are just like, the fictional person in their mom's basement benefiting Medicaid expansion. The people who are depending on these enhanced premium tax credits are folks who make, $100,000, $125,000 and less. Next slide, please. So yeah, unsurprisingly, that's very popular, especially the more that you talk about it. People want these tax credits not just extended, but made permanent. And I'm a little under that, so I'm gonna go through this later. All these slides will be made available after. So let's go to the next slide, please. Yeah, that's more information about like who's benefiting from these. Again, it's working class folks, it's low and moderate income households. They're going to get a world of hurt in the next year and a half. And it's more important than ever for these folks to share their stories right now as Congress is debating whether or not to extend these and hopefully even make them permanent. Next slide, please. Here's one thing that I want to impart when we're talking about what to do about this, because I know it feels kind of overwhelming right now. Like, what can I do? I'm a single person. I'm a person in St. Petersburg, Florida. I'm in Detroit, Michigan. I'm wherever. Here's the thing. In this era, and I know that like there's so many ways to get the word out, right? That people consume news in so many different avenues now. There's cable news, there's social media, there's TikTok, there's podcasts, there's national news. The thing is, among all of those, there's only one source that people trust more than others, and it's their local news. It's their local newspaper. It's their local news. People consume it a lot of ways, but they don't trust those podcasts. They don't trust Joe Rogan, right? They don't trust YouTube. They don't trust social media. Of course they don't. That's intuitive. They consume it, but they don't trust it. So the more that you can get to your local reporters, your local newspapers, your local news outlets, that stuff's gold. People will trust it. Next slide. So in that vein, that's where we at Protect Our Care are focusing a lot of our efforts. Is in districts, is in states, is trying to get to those local porters to write these stories and showcase storytellers, right? People can share their experience, talking about what premium tax credits have meant to them so far and how devastating it would be if those were to go away. Next slide. So we're going to public health now. So I'm going to wrap things up in a little bit, but first I've talked long enough, and now you get to hear from the smart person, Becky. Over to you, Becky.
Hi, Adam. Thank you. And thank you to Rising for having us on this evening. I'm really glad to be here tonight with all of you. And we'll start out by saying it is true that I was on Jeopardy, but I'm going to have to confess I did not win. So you can calibrate your opinion of my presentation thusly. So I'm taking the baton here to discuss one other important aspect of the work we've been doing at Protect Our Care this year, which is really shining a spotlight on Donald Trump and RFK Jr.'s blistering assault on public health and science and how that is impacting the lives of every American. So I was putting this presentation together and I thought I need to find some recent headlines that really show what's been happening to our public health system. And these are all, I think, from the last couple of weeks here, and you can just really see this depth and breadth of this attack on public health and on our healthcare. I'm sure most of us have seen by now the clips from the president and RFK Jr.'s press conference on Monday, where we saw the president of the United States repeatedly just haranguing women not to take Tylenol and not to vaccinate their children because of his completely unproven crackpot belief that this is the cause of what they're describing as an epidemic of autism. And it's just, I think we haven't seen that kind of incredible medical disinformation being disseminated by the president of the United States, well, since, the press conferences that Donald Trump gave during the COVID pandemic, urging people to inject bleach or, use light to cure COVID. And so we've also seen RFK Jr. replace the CDC's vaccine advisory panel with a bunch of unqualified anti-vaccine zealots. And what did they go and do? Well, just last week, they went and voted to limit who is going to be eligible for this fall's COVID vaccine, which is causing just a tremendous amount of confusion. People don't know whether they need a prescription from their doctor, whether they'll be able to go to a pharmacy and get the COVID vaccine this fall. And it's just causing, total chaos. And then, also across the board, these cuts to science and to research, they're shutting down the war on cancer, really. And I think nobody voted for this. No one went into the voting booth in November 2024 and said, what I want to do is end cancer research and stop developing cancer cures. But that's what we're getting. And then, of course, we've seen, as many people predicted when RFK Jr. was nominated to be HHS secretary, this surge in vaccine preventable illnesses like the measles. We had this outbreak of the measles in the southwestern United States, in Texas earlier this spring, and we saw 2 children die of the measles, which is a completely vaccine preventable illness. And we have our Secretary of HHS out there, advising people to take vitamin A to treat the measles and to try all these quack cures instead of vaccinating, which is the one thing we know can stop a measles outbreak. So that's just sort of an overview of just the past few weeks in public health. If we get the next slide, please. All of this is documented at Protect Our Care. We have a weekly report called Public Health Watch that really gets into all of these ongoing actions being taken by RFK Jr. and the Trump administration to dismantle our public health system. It's really our primary tool for making sure that our partners and our allies and the American people know exactly who is responsible for this chaos in our public health system, and who is responsible for reduced access to vaccines and these growing outbreaks of easily vaccine preventable illnesses like the measles. And so in that we cover a lot of things, but really focus on vaccines, on the devastating impact of all these cuts to research, and the mass firings at NIH and CDC, as well as these disease outbreaks, and then also all these other MAHA activities. RFK's really insidious autism project, which is continue to stigmatize individuals with autism and their families, and push these really questionable causes and cures for autism, rolling back water fluoridation across the country, and just all of these aspects of this attack on public health that are being led by RFK Jr. Should I get the next slide, please? I don't want us to feel like we're totally helpless in the face of this. We need to keep sounding the alarm. We have seen that RFK Jr. has become a political liability for Republicans, and you've seen some of them really start to try and distance themselves from this very unpopular agenda. Americans are souring on this MAHA movement and on RFK Jr. The more he moves to dismantle the vaccine system, the less popular he gets. And we just saw in the last week, a Washington Post Ipsos poll showed that Americans disapprove of Kennedy's job performance at a 55% to 42% rate, which is a marked change. And Quinnipiac also this week found 57% of registered voters are not confident in the medical information from RFK, and his disapproval is rocketing upward since March. And you can see at the bottom of this slide a literal screenshot from television today that just shows RFK's net approval rating going up and up and up and up. The more people hear about what he is doing, the less they like it. And vaccines, I really want to emphasize, are incredibly popular across the board. That's 70%, 80% popular. Republicans, Democrats, everyone, for the most part, is very supportive of vaccines and having access to vaccines. And so everything that RFK Jr. and Trump is doing to limit that access or to dissuade people not to get vaccinated is very, very unpopular. So we're going to keep sounding the alarm. And we hope that you'll do the same. And yes, I just saw in the chat, Representative Haley Stevens in Michigan introduced today impeachment articles against RFK in the House to continue to draw attention to just the devastating harm that he's doing to our healthcare system and public health. Just a couple weeks ago, we held a press conference right before RFK testified in the Senate Finance Committee with a number of members of the Senate, as well as the House Democratic Doctors Caucus and our friends at 314 Action, calling on RFK Jr. to resign or be fired. We had a number of senators, including Tammy Baldwin and John Ossoff and Angela Brooks, and again, about a half dozen members of the House. So we're going to keep pushing and sounding the alarm, and we hope that you'll subscribe to our Public Health Watch and share it. If you have stories about being denied vaccine access, not being able to get the COVID vaccine, please share them with us, and we'll continue to amplify and share those as well. And I'm going to kick it back to Adam to share a number of other things that we are going to continue to press to do, and we hope that you will, do as well.
Yeah, and this is our last slide, I promise. But we wanted to leave you with some action items. So if we go to the next slide. So we are action oriented. This is an imminent threat right now. Someone described it as like the triple crown, and that like healthcare is like a thing that everyone cares about. It's a thing that like people trust Democrats more than Republicans on, and it's a thing that is a persuadable tool, right? Like people are actually movable on healthcare in a time when like no one's movable on anything. So we need to take advantage of that, strike while the iron's hot. Our advice, I know it's boring. I know it's played out. I cringe and I roll my eyes every time someone tells me to contact my member of Congress. But seriously, this is a really good time to do it as Congress is considering making these tax credits permanent. And as Congress has shown themselves to be a little bit squishy on RFK, look no further than Senator Cassidy of Louisiana. But honestly, there's a lot of them that kind of realize like, boy, this is even worse than we signed up for. So contacting your member of Congress is actually a really, really helpful thing right now. But also contact your local reporters, because we've seen it's a useful mechanism. It's a trusted source of news for your friends, neighbors, community. It's a thing that people still listen to. Share your own experience, write op-eds, submit letters to the editor, post on social media. More is more. Highlight stories of yourself if you rely on premium tax credits, Medicaid, any of these healthcare aspects under threat, or people that you know who are on that. Take advantage of key dates and news hooks. We are coming up on open enrollment on November 1st. You can start an artificial countdown to that if you'd like. You're going to see some premium rate announcements coming out soon. Latch on to that. And once open enrollment starts, the people start to react to the sticker shock of it all. Latch on to that. shoot, make up a theme day, make up a theme week, whatever. Either way, any way we can talk about this, more is better. If you'd like to team up with us, we have teams in 11 states, I believe. I've listed them here. And if you want to hear more from me and Becky when we're like at our best and most well rested, twice a week we host a very quick call, 15 minutes or less, 9:45 Eastern, every Tuesday and Thursday. We go over the healthcare news of the day. She goes over public health. We talk about what we can do about it, and we talk about threats that we see coming down the road. So if you're interested in that, send me an email. We'll get you added to the email list. You can join the calls. It's like, the world's driest podcast, but shoot, there's enough podcasts. Why not us? But really, really thank you just for listening to us, caring about this. We need more people like you. And I appreciate Moms Rising for letting us have the space to do it.
Yes, thank you so much.
Thank you. Thank you so much. Oh, Rebecca, were you about to say something?
I was just thanking you at Moms
Oh,
Rising for having us on today.
thank you, Amanda and Rebecca. Thank you so much. Please, everyone, use the emojis to give them a round of applause. That was so much really great information. And I know they're going to drop those action items in the chat so that you can grab them again, as well as ways to connect on the regular call. So next up, we have another amazing speaker. We have Erin Melton Backus joining our meeting. Erin was a health communications specialist at the Center for Disease Control and Prevention before being laid off by the Trump administration earlier this year. Since her Erin found Fired But Fighting, the National Public Health Coalition, a grassroots movement to support terminated HHS employees and advocate for public health. Her group hopes to help address the current cuts to our nation's public health system, as well as address the underlying issues that have led to the distrust of public health, science, and medicine. We talked a lot about that tonight. She's an Atlanta native and holds a master's of public health from Emory University. Erin, thank you so much for being here and thank you for your patience.
Yeah, thank you for having me. Let's see, I have a few slides. Perfect. So like Monifa said, my name is Erin. I was a health communication specialist at the Centers for Disease Control and Prevention for almost 7 years before I was fired earlier this year. And apologies if any of this information is a little bit duplicative, but I'm going to go over a little bit about what's going on in public health right now and my organization. So if you can go to the next slide. So who we are, so the National Public Health Coalition slash Fired But Fighting, we are a group of current and former health and human services employees and allies who are trying to educate about and advocate for the protection and advancement of public health as a vital government service, past, present, and future. So what does that mean? We really want to work with our communities, our lawmakers, our partners to talk about why public health is so important and why it protects all of us. And the name change. So we started as Fire But Fighting, but have gotten some really good feedback that that is maybe not the most, long-lasting name, and it doesn't encompass all of the people who might want to join our coalition. So we're transitioning to this new name, but you might hear me refer to them interchangeably. Next slide. Okay, so I want to go over a little bit how we got here. And Rebecca and Adam touched on this a little bit. So sorry, this has some animations on it, so you might need to click through it. So January this year, Robert F. Kennedy Jr. is confirmed as Trump's Health and Human Services Secretary, despite a lot of objections. You might remember that Senator Bill Cassidy, a Republican from Louisiana, cast one of the deciding votes to confirm him, despite having some concerns himself. Senator Cassidy mentioned that Secretary Kennedy made assurances that he would not, touch vaccines at all, and we now know that that is not true. So then, in February of this year, thousands of workers were initially laid off. These were probationary employees at agencies across the federal government. Even though they're probationary, it mostly just means that they were new to their roles, even if they weren't new to the federal government. So I was actually one of these, even though I had been at CDC for almost 7 years, I was considered probationary because I'd recently had a promotion. Then in April, there was a massive, what we call reduction in force, where thousands of jobs and programs were cut across the Centers for Disease Control and Prevention. More madness. And then in August, things get even worse when a shooter fired over 500 bullets at the CDC headquarters. And now we know that he did that because he had some bad beliefs about COVID-19 vaccines and blamed them for some of his health problems. And unfortunately, that shooting did claim the life of a police officer, David Rose. Then just a few weeks later, the newly confirmed CDC director, Susan Menard, resigned, as well as a couple of other agency leaders, causing a lot more confusion at CDC and kind of this vacuum of leadership. So it's just really chaotic time in public health and healthcare. There's a lot of misinformation out there. I didn't even go over the advisory committee on immunization practices and the way that they were all terminated. But understandably, a lot of us are very concerned about what's happening. You can go to the next slide. So on top of all this, we're seeing this really big spread of misinformation related to public health, and it's being amplified by, the highest offices in the land with President Trump and Secretary Kennedy's press conference this past Monday. So I think some of the things you might have heard about is misinformation related to COVID-19, vaccines, autism, acetaminophen use during pregnancy, and many, many more. They have come out and said that Tylenol use during pregnancy may lead to autism. We know that the science does not say that, and in fact, it's very irresponsible to tell people not to take Tylenol if needed during pregnancy because having a high fever can, in fact, cause developmental delays and harm a developing fetus. They've come out and said that we need to change the ages for vaccines. We need to break them up when that's not necessarily true. And then also very harmful, just the lies that they've spread about children and families who have autism and the ways that they impact them. And it's just not helpful to anyone. You can go to the next slide. So I want to touch on what this means for families. So with all the cuts to CDC and the Health and Human Services agencies, you're going to see less programs that are provided by the agency. So 80% of CDC's funding actually goes back out into communities and states. So my office, the Office on Smoking and Health, has been completely eliminated. And one of the things that that office did was provide money for a quit line for people who want to quit smoking or quit using tobacco products, which I think we can all agree is very helpful. It also provides, information for to help prevent youth from vaping, which is also a really important issue right now. Another program that was cut was the Division of Injury Prevention, which works on drowning prevention programs. And drowning is actually one of the number one causes of death for children under the age of 5. So it's a very important program. So I think as this reduction in force takes place and we move into the next budget, we're going to have a lot of programs that you might not even notice that exist in your community start to disappear. We're also seeing more distrust of trusted medical and public health interventions, mainly vaccines. I think, especially with, this misinformation being spread from the president and the secretary, you have people who would normally never question whether they should get their children vaccinated. They're coming and saying, maybe I shouldn't vaccinate, or maybe I should delay my child's vaccines because the president says that it could do this. And we know they don't have medical training. They don't have a scientific background, so we don't know why they're saying that. But it's very concerning that people are not trusting these medical interventions. And I think, unfortunately, we will see a rise in vaccine preventable diseases, and that's very scary. And potentially we'll have less access to safe and trusted vaccines or less insurance coverage for them. Without getting too in the weeds, one of the things that the Advisory Committee on Immunization Practices does is they provide recommendations for what insurance programs, especially Medicare and Medicaid, will cover for patients. So while Robert F. Kennedy Jr. might go out there and say that people still have the choice to get a vaccine if they want it, their insurance might not cover it. And I don't know about you, but I don't have an extra $200 to pay for a COVID-19 vaccine if my insurance hasn't covered it. So it's all very, very concerning. And I think there are a lot of people out there who don't even know that, all these cuts to the government are going to impact their families like this. Next slide. So there was a lot of information, and it sounds very doom and gloom, but I think there are a lot of things that we can do to help fight back. Like Adam said, I know it is really frustrating to hear over and over to call your representatives and senators, but it's very important. I was just up in Washington, D.C. this past week, and I'm doing visits with House of Representatives people and their staffers. And one thing I heard over and over again that the main call that they're getting right now is about Robert F. Kennedy Jr. and the fact that he needs to be removed as HHS secretary. So people are hearing that. Republicans are hearing that. They're starting to lose faith in the secretary. So keep calling and keep telling them that we need Robert F. Kennedy Jr. to be removed. The other thing you can do is if you or have any questions about your health or your child's health, if you're pregnant and have worries about what vaccines or medications you should or shouldn't get, please talk to your healthcare provider. They know you and your situation best, and they are the ones who can give you the best advice about that. I would also say talk to your friends if they're having any worries about things that the president or the secretary are saying, and just talk through them about what is happening and encourage them to talk to their healthcare provider. And it's very easy to, slip down into this path of being anti-vaccine and anti-medicine. So if you're having honest conversations with your friends, it is really helpful to figure out where they're at and hopefully help before they get too far down that path. You can also follow our work or get involved. So we're on Instagram and Blue Sky. We have another website, nationalphc.org, that is coming soon. But right now you can find us at firebutfighting.org, and you can also email us at info@firebutfighting.org.
Thank you so much, Erin. Please, everyone, give her a round of applause. Fired but fighting back. Thank you, one, for being a champion for public health, but also for staying in the fight, especially after being attacked by the administration. We've all got your back, and thanks so much for coming tonight. So now we're going to have two quick questions before we hand it back over to Kristen for our closing. And I'm thinking that one of the questions we can actually give to Kristen that she can answer in the closing. So there is a question about, well, there's two questions actually. So one, which is for you, Kristen. No, this is for the Protect Our Care folks, I think. Is there any movement towards reducing the amount of profit insurance companies can collect? That's one of the biggest problems. One of our attendees have written. Other countries use nonprofit structures. I think Obamacare originally capped their earnings. So maybe Adam or Rebecca can answer that. And then after they do, we'll pass over this top question to Kristen as part of her closing, which is basically what can be done to affect change? What can the Dems do, especially if they're in the minority? Basically, like, what can we do? So we know that that question is right up your alley for the closing. So first, I saw Rebecca come on camera, so I'll hand that first question over to Rebecca.
I've got to say at the moment, no, I don't think there has been much movement in that direction. I know it's something that's been tossed around as an idea for quite a while, but at the moment, with Republicans in control of the House and the Senate and the presidency, I think the options for expanding and building on the ACA are at the moment a bit limited, and we're really focused on trying to prevent the backsliding that we've already seen as part of the Big Beautiful Bill, and then as well as the ending of the tax credits.
Thank you. Thank you for answering that. And last but not least, we're going to hand it over to Kristen to answer a question and to close us out for the evening.
I love this question of what can we do? I love this question of can we make change? Because the answer is yes. We absolutely can make change. We've proven in the past that when we don't give up, that we can make change. The important thing right here is one big thing. Can we make change immediately? No. Can we make change if we all don't give up, if we all persist, if we all insist, if we all vote when elections come? Yes. And can we make change by sharing our stories, by taking action, by changing the narrative? Absolutely, yes. So I'm going to put in the chat right now the links that we've been putting in throughout this whole conversation tonight, and I'll talk a little bit about them. The first one is a quick signature to tell Congress to stop the rising healthcare costs, reverse the cuts. As you heard from our other speakers, we're actually getting traction. Polls are changing. Members of Congress are getting worried about their reelection because tens of millions of people are poised to lose their health care. That's Republicans, that's Democrats, that's Independents, that's Green Party, that's Libertarian, and nobody of any party wants to lose their health care. Everybody gets sick. Everybody needs a chance to get better. That's action 1. Action 2 is your stories. And sometimes people think, my story doesn't matter. Well, it really does. For example, we have shared story after story after story and seen votes change. So we know that when you share your story, that you can open people's eyes, elected leaders' eyes, the media's eyes, people around you's eyes, so that they know they're not alone, and really make change with your story. Very powerful. Your story only has to be a couple sentences. It can be longer, but you don't need a long story to make a difference. The next one, action 3, please tell Congress, fire RFK Jr. It's ridiculous. What he's doing is not science. It's weird. It's awful. It's destructive. He needs to go. We have a bonus action. This one I'm really excited about. You heard us talk about rising prices of vegetables, of coffee, of healthcare, of everything. Well, we're asking people, yes, people means each and every single one of you, to take a picture when you're out and you see any price tag that is making you go, like if you see the milk and it's up, the eggs and it's up, the coffee, of course, when it's up, the gas price when it's up, your healthcare bill when it's up. Delete your personal information, please, when you take the picture. Any bills that are making you gasp, take a picture of it with your phone and then post it on any of your social media, Instagram, Twitter, also known as X, Blue Sky, Facebook, with hashtag Trumpflation next to it. We got over 500 million impressions trending on Trumpflation recently. We want to keep the pressure up and show that the policies that Trump's pushing with chaotic tariffs and regressive bills is actually playing a big role and the rising costs and breaking his campaign promises. So that's that one. That's a bonus action. In addition, if you want to read and share the senator's report on how much healthcare is going to rise by state, yes, please do that. That's also very helpful. Even members of Congress don't realize how awful their actions are making it for all of us. By members of Congress, I mean Republican leaders, because Democrats have, in fact, been standing strong. So those are our 4 with a bonus of 5 actions that we have. And I want to thank all of you for persisting, for insisting, for standing up to protect our democracy, for not giving up on one another, for not giving up on our communities, and for keep pushing. Keep rising, and for being Moms Rising. I want to thank our speakers, Senator Maria Cantwell, Adam, Rebecca, and Erin. And I want to thank our tech team led by Geronimo. Woo, let's give some hearts. I want to see some hearts. Where are the hearts? I want to thank our interpreters, Murtado and Florida. Hearts for them too. Thank you, thank you, thank you. And I want to thank the Moms Rising team and leaders who are with us tonight. Monifa and Jada. Woo! And I want to thank all of you, each and every one of you who's not giving up on one another or on any of us. So thank you, thank you, thank you. Woo, hearts, hearts, hearts. So thank you to everyone for being here. We will be getting together for our monthly community Zoom on Thursday, October 23rd. Yes, we'll be there. Maybe we'll be wearing Halloween costumes. I don't know. But we'll be there, and we look forward to being there with you. And we look forward to taking action and taking back our democracy. Thank you, thank you.